Bloomberg Audio Studios. Podcasts, radio, news.
It is one of the big stories of the morning. What is happening with Novo is fascinating, as you say. Company coming out this morning, cutting revenue, missing on a number of metrics. But look at the share price. Last time I checked, and it was just up on the screen just a moment ago, up by, one and a bit percent. Does that signal maybe that the market believes that this quarter, this Q3, is the bottom? Let's ask Mike Doustdar. He is the CEO of this business now. Great to see you, Mike. Thanks for spending some time with us this morning. Is that the right interpretation? Is this the kind of the bottom? Is the glass half full from here after being half empty for so long? Do things get better from here?
Well, what I can tell you is that the first 9 months of the year, 15% sales growth and 10% profit growth is not so bad at all compared to our peers. But I think that when you look at it quarter by quarter, there has been a headwind and bringing the quarterly growth rates lower.
Okay.
If you project our numbers for the full year, actually you see that quarter four should be in negative territory. So that you see mathematically.
So this isn't the low point. The low point is still to come, but things get better from there?
There's for sure a headwind against us.
Yeah.
Having said this, we are in a business of marathons and not sprints.
Okay.
So there is huge amount of unmet need with many patients still not on our medications or not on any medications. And I look incredibly forward, of course, as we go forward, taking over this new job, making sure that we expand the market and get to those people.
You've been in the job for 91 days. You haven't let the grass grow under your feet. You're already talking about cost cuts. We'll talk about it in a minute. You've launched a big M&A deal. Is this the new Novo? Is this a more dynamic, aggressive Novo Nordisk under your tenure?
The success we have had with obesity has meant that a lot of companies, pretty much all pharma companies out there, has gotten excited about what we do. So that is good from a patient's perspective.
Okay.
More players will come in.
What about a shareholder perspective?
But at the same time, we have to make sure we can outperform the competition from a shareholder perspective. So my job is to really make sure that we are ready for the headwind that we clearly are seeing coming towards us.
When are you going to match Eli Lilly in terms of performance? They had results a few days ago. They were knockout. When are you going to be able to match that kind of performance? You talk about a kind of a performance culture here.
Again, my job is to put the patient in the center of what I do and not necessarily just my competitor. We watch them. We take all of our competitors seriously. But there are hundreds of millions of people out there that are suffering from diabetes and obesity that no one is right now addressing. My job is to sustainably lead ourselves towards that aim.
How does Metsera help you do that?
Metsera has some of the best complementary assets to our own phenomenal pipeline. So when the ambition is in billions and not millions, you need basically all the great assets to get.
Great assets, but complementary. So why do you need complementary assets? Because you've got all these products. Why do you need to go and buy this business?
Because obesity and diabetes is not a single disease. It's an individual disease. You basically have different preferences. Take a look at the great Wegovy pill we're about to launch in US. Well, that's for people that don't like injection.
Sure.
They would like to lose weight, but they don't have a viable offering from us or the competitors.
You've got very similar products. And the question that I've just listened to a lot of analysts, talked to a lot of analysts, and the question they keep coming up with is, does this seem to signal maybe that you don't believe in the current Novo portfolio?
Absolutely not. Absolutely not. We are in a situation where every single patient has a different preference. Right. And we need to have the product offering that matches that.
They got a monthly, you got a weekly. Is that really the big difference?
Well, we saw that the weekly was a big difference to the daily one.
Okay.
So I would say for
monthly does make a difference?
For some, probably yes. For some, probably yes. Others will prefer to have a weekly product.
Is it more important that Pfizer doesn't buy it than Novo does buy it? Because that's another thing I hear as well.
My focus is on Novo Nordisk. Right. The way I see this is there's a company for sale, there's a buyer and a seller.
Yep.
And basically, one of the buyers doesn't like the price, and the other one does.
Okay.
My job is to make sure I look at what we need, and we would very much benefit from Metsera's assets, and we put the right price up there our price.
What's the right price? Could you go higher?
The current price in the market has been, addressed by Metsera's shareholders, and then we'll see where this goes.
Do you think Pfizer comes back?
I have no idea.
You have no idea, but if they do, will you go higher? How important is this asset?
I'm not going to make an announcement today on how I'm going to treat this.
How do you make sure you don't overpay for this asset?
By having actually looked very deeply into the data. As I mentioned, we know this company very well. We have seen this company for a long time, and we like what we have seen.
Okay. You're going to London, I think, tomorrow, right?
Possibly.
Okay. Are you going to the States after that?
I'm looking at the whole world, so I'm going to go everywhere.
So the rumor is that basically you're going to be in the White House on Thursday, and you're going to tell me that the deal's not done with the Trump administration on pricing, and I'm going to ask you, how close are you, therefore, to a deal?
I'm going to say that we are very much aligned with the purpose of the negotiations and the discussions we're having with the administration. We both would like to provide access to many more patients out there, affordable access.
Are you close?
So we are discussing very closely.
Okay. Okay, closely. One of the parts of the discussion, I'm assuming, has to be about what is happening with copycats, about the companies that are producing drugs that were allowed when there were shortages, but now are using loopholes to maybe continue to produce products. And I'm wondering whether or not a deal with the White House would include maybe closing some of those loopholes. What are the compounders doing in terms of your business right now?
What I can tell you is that we have been quite surprised on how the compounding has gotten started.
Right.
Taking an API, the raw ingredient of a medication that has not been approved by FDA, and injecting that into human beings is something very far from what we have been educated in this industry. So we will continue to lobby for the administration
with the White House?
What have you, that this is simply not right.
Yeah.
I will not get into the details of the deal, as you could imagine.
We will wait and see what the deal looks like later this week. Mike, great to see you. Thank you very much indeed for stopping by to see us. We really appreciate it. And thank you for inviting us to the headquarters. We really appreciate that as well. Mike Doustdar, the CEO of Novo Nordisk.